you write it down, please document it. You need to give active listening again. It's also important. Anyone you are talking with, please always give a good listening ear. It says good about you and it gives the person impression. It even gives the person impression that you are giving them 100% attention and you are giving them opportunity to even tell you the more, especially if the discussion is something you are going to grab. Even if it doesn't, it's not relevant to you, you can politely, ask them one or two things and try to hasten it. But don't always give them active listening here. Magic words, it goes a long way to help, especially when you are discussing with the nurses. Please, any of your colleagues, thank you. Please, can you do this for me? Please, could you help me get this? It goes a long way to help, and it builds a strong relationship and improves care. So, how do we communicate now with other NHS staff? Just as you do with the nurses. Why I had to be so specific about nurses is that they are the people we communicate on our day-to-day basis. Every day you communicate with your nurses, and they are the ones closer to the patient and the one that knows the patient very well. So you need to, that's why I put them separate. You need to really, but for other staff, like we have the physiotherapists, the occupational therapists, pharmacists, porters, admin, you need to also communicate with them clearly. You need to be professional. You need to be inclusive. Sometimes you have a porter coming to help you transfer a patient maybe from theater to the ward or to transfer for a test and everything. You need to, let them know that they are part of the team. You don't, treat them, if they request for anything, answer them politely. And if there is anything you need to clarify, please be polite and be professional. You need to show them respect as well. Ensure clarity in referral, handovers, and plans. So any referral you are doing, you are writing, whether on calls or anything, please clarify. And sometimes the lab or probably maybe the scan, they might call you back, they want to check something. And please, if you don't know the patient, you can always tell them, please, can I get your extension number? Can I call you back on this number in 5 minutes? Let me go through the patient because I don't have a clear head of everything about the patient now. So it gives the patient impression, and be polite all the time. You always go and check up on the patient and go back and clarify. So use agreed communication channels. I think we sometimes try to use our phone, we use WhatsApp, and it's not really, really good to use such communication channels because they feel they are not secured. The messages are not secured. And there are blip system. Always make sure you let the people you're working with communicate you on blip. Rarely, sometimes you might have people calling you phone. Like I could remember one of the days I was on call and they blipped me twice. I didn't even know, to be frank, I didn't know that I was blipped. And the nurse had to call me on phone that they needed my attention. And I had to, so it's not as if they will not call you on your phone, but let the blip system always be with you. Try to make sure you communicate because it's recorded, it's secured. And try to avoid all those social media channels like WhatsApp. It's not really secured and there are some loopholes. So communication with patients. So when you go to your patient, how do you communicate with them? You need to exchange greetings warmly with clear introduction. You need to tell them your name and you have to tell them your role because by telling people your name, it gives them like this kind of confidence to be able to talk to you. They feel free. Oh, Esther, they can call you Esther, they can call you this, they can talk with you. You need to use simple English as well. Avoid medical jargon when you're talking with patients. Confirm understanding. You need to ask them to repeat. I think I've mentioned that before. You need to, when you are delivering information, when you're communicating, you understand, you want to explain, tell me, can you repeat what I said? Let me see how far you understand me. Probably I will need to go back and explain more. And if it gets to that, you have to do it politely. And then be sensitive to cultural differences and body language, eye contact. We have people with different medical background. There are some cultural people, there are some cultural background that they don't like eye contact. So don't take it as offense. Just concentrate on discussing, on making your information well understood. And then uphold NHS values. Our values are dignity, respect, and compassion. Please always make sure you have this. And use interpreter when needed. Yeah, very important. You need interpreter. When you see that there is a language barrier, you need to use interpreter. Especially when, even if it's emergency and you see you have time, please get an interpreter, professional one. I know sometimes the relatives might be there, they will tell you they can interpret it, but it's not right because they might not tell you everything the way it is. You need to use a professional one so that you'll be sure that the family is also, that you are in the same page with the patient. Then sometimes it's very important to know the medical background of patients before you even go ahead to communicate with them. Before talking with patients, you must have gone through the notes, you know the patient's medical background. If this patient is autistic, you have to be careful. Of course, the way you talk with, you have some discussion with people with autism, learning disability, it's not the kind of discussion we'll have because for autism, they are specific. They can't multitask. So you don't give them a lot of information and want them to assimilate immediately. You just give them one by one, check the understanding and move. You need to give them patience and to be patient with them. And sometimes you don't, I mean, what I mean by not being like, you can't meet an autistic patient and say, okay, I'll come back to you at 1 p.m. They will be waiting for you by 1 p.m. because they are specific. So you need to be broad. You need to have your way. I think each hospital have their protocols. It will be nice. You learn how to. If you think this patient has some difficulties or this patient has some learning problem that you might not be able, you might look for your senior help to help you pass the information, to do the communication while you watch, and you might request for a training. There is room for training. Always speak up. Don't keep quiet. If you think you don't know this, please ask, how do I get trained in order to get it known? Is there any hospital protocol? Is there any intranet? Is there any anything? Can you refer me to somewhere I can read or watch some things to help me to build up my confidence in this particular field? There is always room in asking. If you don't ask, people will think you know it and they will judge you by the way you act. So you need to speak up and say you need some more training on this particular field so that they will help you. So communicating with difficult patients, you need to stay calm and professional. Some patients are very difficult. Um, One, it could be due to their medical background. It could be due to being phobic for hospital. It could be pain. It could be stress. So many things. It's multifactorial. You don't know what's making them. Don't take it personal. Just stay calm and professional. You need to involve a senior if there is need. If you think it's something you cannot handle, or the patient is not even allowing you to talk, and you know you can't you can't meet up with communicating with this patient, call for help. You might even want to bring a chaperone. You can bring any of your colleagues or any of the nurses to help you, to be by your side, to help you. There is this tip we usually use when we're approaching difficult patient. We call it head approach. You try to hear the patient out, listen actively, you avoid interruption, allow them to talk. And you need to empathize with their concerns. You know, things like, I'm really sorry to hear about this. I'm really sorry that this happened to you. I'm really sorry that you had to go through all those, because most times they will tell you their problem. You need to acknowledge their emotions. I can see this is really upsetting you. It's really upsetting for you. I can see that you seem so angry with the thing, but I think you will need to calm down a bit so that I can help you. You respond to their issues, be factual and calm, and you need to set boundaries respectfully. Tell them what you want them to do in order to help you. Like sometimes times like I work in obstetrics. Sometimes there are some times when you are dealing with patients who are in pain. They are really difficult. You need to do some procedure for them, and they are in pain, they are in labor. You can't control them. You need to set them, you need to respectfully tell them what you want them to do. Sometimes you see them, they will even leave their bed, they are lying on the floor, they are in pain, in labor pain. You need to, we have come to, put epidural for them. You want to stop the pain, but you can't do that if the patient does not comply, if the patient doesn't stay quiet. So you need to let them know politely, not with disrespect. Even as they are there, you are there to help them, but you need to set set the boundary to let them know what you want. Please, is it okay if you sit? I know I understand that you are in severe pain, which I know, and I could see that you are in very severe pain. But I can't help you if you don't stay quiet, because if I want to help you like this, I'm going to cause more complications to you. In that moment, they are not even listening. But for the fact that you are not doing anything to them, you want them to stay quiet, and you let them know that if you don't stay quiet, I'm not going to do this because I'm going to cause more injury to you if you move. The area you are going is through the spinal cord. So you need to let them know, understand. Don't say you want to. Sometimes when you talk, stay and talk. Don't touch them. Sometimes it's actually not good to touch patients. In as much as they are in pain, stay by the side and make your word heard, what you want them to know. Then you need to document every encounter clearly. Like I said before, if you don't document it, it never happened. So documentation is what we hold as our power. When I discuss with you, I document. And sometimes some of your colleagues will call you, did you discuss this with this patient? What did the patient say? You might not even remember because you are seeing a lot of patients. So you have to just tell the person, please, can you go through my documentation and see what would do? I have documented very well. So that's the key, because we tend to document a lot for different patients, and you are not a computer. Even if you're a computer, you're not going to remember everything unless you are prompted to. So breaking bad news, how do we break bad news to patients? This is another important point, because many times we tend to break bad news. If you're working in the emergency intensive care unit, if you're working in oncology, if you're working in lab, where although lab people most time they don't have encounter with the patient, but like there are some department that I know often where you need to break bad news more often. So one, you need to prepare. You need to go through the patient's folder or patient's need to go through the patient record to find out what has happened, how this happened. Then you introduce yourself, tell the patient the role, find out the patient's name, because you need to communicate by calling their names. And then it's also good to find out what they want you to call them. Some might have a very long name, but they prefer the name to be abbreviated. Check with them. Is it okay? You said your name is Esther. Is it okay if I call you Esther? Yes, you can call me Esther. Then you move ahead. You call the person Esther. Assess, what do you understand so far? You want the patient to tell you what they understand about their health. They will tell you from beginning to at the level what they know, what they understood. Then you want before the news. It's true, you have told me about this. You said you had CT scan done yesterday, done 3 weeks ago, and they said you had some tumor, a growth in so place, and the sample has been taken to do histology. Now the result is out, and I'm afraid I have some bad news. Then you tell them what it is. If you use simple language, don't use a medical jargon, and then you pause after the news, and you need to watch them, allow them to assimilate, understand, and sometimes they might want to cry. They will just allow them to relieve the pain. It's not easy to receive a bad news. The only thing you can do, you might want to give them tissue paper if they're crying, get them some water to drink and other. Then after everything, when they pause, sometimes they might be the one to prompt it again. Okay, doctor, now what's the next plan? Then you come up, I'm really sorry. I can see how hard this is on you. Um, uh, um, we have had an MDT, or we are planning to have an MDT this afternoon. And after that, we'll get back to you to tell you the final plan. Or if the plan has been set already, you tell them we had an MDT. This is what the team has decided to do. And I would like to offer you some information. This leaflet, it contains everything about it, the effects, blah, blah, blah. And it could also gives you some options of management. And we would like to see you in so time. We also want to refer you to this, so this. Just explain what the plan is to the patient, and then check understanding and everything, and you greet the patient and go. Sometimes we have a spike protocol that we use. Settings, the place you want to break the bad news is very, very important. You need to, take the patient to a calm place. You need to offer the patient seats. You need to also check if they want to have their relatives around. Do you have anyone around? Do you want to be alone? Do you think it's something you can do alone? Or, oh, I have my sister. She just went downstairs. I want her to come up. Okay, let's wait for your sister to return. When the sister comes, she will have a support and you break the news. You need to have perception. What does the patient know? Just like I've explained before. Invitation, how much you want to know. Sometimes we want them to know, do you really want to know everything, or you want to see anything you don't want to know about it? They will just tell you. Knowledge, give information gently. Emotion, you need to respond with empathy, and strategy or summary, you agree on the next plan, and then agree with the patient. So some people use this SPICE protocol, and it's really nice. It's GMC recommended. Then communicating with families. So how do we involve families? You involve families when it's appropriate. For unconscious patient, you might not know when it's appropriate, or when it is appropriate. In that case, you want to discuss with the next of kin, and make sure that you hold on to the next of kin, and don't discuss anyone, because some people will come in and tell you, I'm one of the relatives, I'm the brother, and they are not. So are you the next of kin? If the person is not next of kin and the patient is unconscious, you want to be careful with what you just opening on information to everyone that comes in and says, oh, I'm related to the patient. And always ask patient consent before disclosing to. If the patient is fully awake and conscious, you might want to ask, do you want your father, your mom is here, do you want your mom to know everything, or will you go ahead? And sometimes they might want to tell their mom themselves. They will go ahead and tell. So and if they come to you, you will tell them you want to check on the patient to be sure that patient is happy with you disclosing their information. And if the patient, just like I've said, the patient is unconscious, you need to do everything in the best interest of the patient. Be honest and compassionate, very important, and maintain patient confidentiality. If there are some parts you think the patient has quoted before, I don't want anyone to know this, you go ahead and maintain. Or if the patient has told you, yeah, I want my mom to know about this, but please, this part, don't disclose it. Please maintain it. It's their confidentiality, and it's very important. And use interpreters for complex or emotional discussions. If the patient, especially if the patient is not, there is language barrier, you want to use interpreters to explain to the patient. Like I said before, you need a professional interpreter, not just any relative. So let's talk about our SBAR, a structured communication tool. This is what we commonly use, and it helps us to simplify our communication with other health professionals, especially when we want to hand over, we want to refer a patient for anything. S is for situation, what is happening. B is for background, what is the contents. And A is assessment, what do you think is going on. And recommendation, what action do you suggest? It is used for safe, clear communication in handovers, emergencies, and referrals. And it's very short and simple. It helps us to quickly summarize the information and pass the information. And it gives clear understanding so that you don't go and, be saying a lot of things, especially in cases of emergency. You just need to be straightforward. So let's have a clear example. If you're asking for help, for the CS, which is the situation, you say, this is Dr. Patel. You are the Dr. Patel from Ward 12. I'm calling about Mr. Jones, who is deteriorating. That is just the situation. This patient is deteriorating. He's 74-year-old, that is the background, was admitted yesterday with fever, UTI, being managed for urosepsis. Sometimes you might want to add, is hypertensive, but sometimes you might want to, just few of the backgrounds, things that are relevant. And now the assessment, patient is now hypotensive despite fluid resuscitation, tachycardic, and confused. So this patient is really going bad. Do you recommend, please review him urgently for possible escalation. You are asking for help from your senior, definitely, or from any of your colleagues. So just keep it simple. And if you're requesting for investigation of specialty, For the situation, you can say, this is Dr. Khan. I'm referring a patient with suspected PE. Sometimes we want to, I don't think it happens I really know about other protocols, but my trust, there are some specific investigation you have to call the specialist to request for. In as much as we request it on the system, you still have to call the specialist to let them know how urgent it is. And this is Dr. Khan. I'm referring patient with suspected pulmonary embolism is really emergency. So you need to communicate. She's 60, that's the background, with recent surgery. You can name maybe the person has recent right neck of femur repair or neck of femur fracture repair and has new onset dizziness. So the patient is in distress. Oxygen saturation is 89 on room air. You might also include what it was previously. The patient is currently tachypneic and tachycardic. Can you please arrange for her to have an urgency TPA? So you have relayed the information, and after hand your request, you go and document that you have contacted the consultants or you have contacted hematologists, you've contacted the radiologist, blah blah for this. And most times, I think it's good to write names. Sometimes when I call, I'll say I'm this. I might know your name. Are you consultant? The person will tell you just document. I've contacted the consultant hematologist, Dr. This, who is happy to accept the patient. Then you plan and move the patient for the CTPA. So there are some tests, like sometimes we also call microbiology. It's not all the tests, like if you want to do some like extended respiratory panel, viral respiratory panel, they want you to call the microbiologist, especially when it's urgent for them to approve the test. You call them. There are some you call hematology. It's not all. There are some routine tests that we usually do, but there are some that you need to call before you go ahead to let them know how urgent it is and why it's. They will quickly go to the system, give them the NHS phone number, and they will go to the patient file and then document that they have approved it. Then tips for junior doctors. You need to practice your SBAR before calling senior staff. Write it down if needed. Don't be ashamed of reading papers. When I came here new, I've been with NHS for almost a year and 7 months or a year and 8 months now. And when I came new, to be frank, the system is totally different. It's not something, if you're not careful, you will just, if you're not careful, you will be seen as being incompetent just because you're not talking, just because you're not communicating. So what I was doing then is that I found it difficult to even to hear people speak. Like when I came newly, I was like, why are these people singing rhyme? Like, I don't even hear, are they speaking English? You ask yourself, is this English language? Because the English I know, and before I came here, I was understanding English. When they gave me bleep for the first time, in fact, after holding the bleep that day, become a terror. If I see bleep, I'll be like, my blood pressure will go high because someone will bleep you, you call the extension, before you say Jack, the person has finished. And you didn't get any single thing. You keep asking a lot of questions, you keep asking them to repeat multiple times. So don't be scared of writing it down. What I was doing then is that I write it down before I call, and I'll gradually tell you that I wasn't really fast. I was so slow, but with time you will improve. Don't look at people. You see people present patients without papers. They don't even look at anything. You want to come and do it, and you get stuck in between. So just tell yourself that for now, as a junior, you are new to the NHS. You need to be writing things down because you need to make your information um, communicated very well. Write it down. There's nothing wrong in reading it. Read it out and tell them when you think you are confident enough, you can always, do without writing it. But for beginners, I think it's not really easy. Focus on the recommendation, what you want from them. That's very important. When you are making a referral, what you want them to do. Even if you are referring a patient to another department, you will always, please, I want you to review this patient with regards to this, or because the patient has developed this, please, could you review this patient aspect? They won't manage the whole patient. There must be a particular thing you want them to do. So put it on recommendation. Even if you are filling a form for test, sometimes we make referral through filling a form. You just put in what you want. If you are requesting for x-ray, sometimes I request for x-ray just to check the NG tube. I don't need you to write a whole lot to you. It's just NG tube. Just tell me that the NG tube is bisecting the diaphragm, is in the stomach, and is safe to use, and I move on. That's what I need. So if the patient has so much consolidations or anything, they won't go ahead, and because that's not what you need. Maybe probably you've done that x-ray before, but what is important at that moment is what you need. Because if past NG tube, you want to feed the patient. Although when they do it, that chest x-ray, you can look at it, can tell you multiple things about the patient, but why you are requesting for the x-ray is this thing. That recommendation is very, very important, because we are all managing a lot of cases. We can't be, we can't come to a patient and have a whole look of multiple things. Then keep it brief and to the point. They may be managing multiple cases, just like I've said. Informal communication in the NHS. Yeah, we need some informal communication. We do day-to-day friendly interaction matter. We build team rapport and trust. You come to work, you meet your colleague. Oh, Esther, people will call. Oh, how are you doing? How was your night shift? That simple smile and everything tells people that, we are communicating, builds rapport. Oh, the shift was so calm. Oh, I could see it on your face. You're really smiling. Just share pleasantries. I hope yours go calm too. Have a good day. Bye. Just little. You need to smile. You need to, it goes a long way to build rapport and help people communicate, and even in team. You always need to maintain professionalism. That is the most important thing. Don't come to work and maybe, let me use an example. I went to maybe a club last night, and I met you there coming to work. You want to start talking about the club. No, just keep it off. Leave the club. You've finished it. Come to work. Share pleasantries, just greetings. You can talk about things like someone, like there was one of my colleagues that just came back. I met her yesterday after like 1 month or so, and I was like, "Oh, Jenny, you've not been around for a long time. I've not seen you. You've been scarred. So you look so fresh." And she was like, "Oh yes, I went to holiday. I just came back from Australia, And we talked about Australia a lot, and just a few things about Australia. And I told her, "Oh, I really like the stories. Like that would be my next target." Oh, you move on, and life goes on. So always maintain professionalism. Sometimes you might want to talk about simple things, but make sure you don't go into talking about family matters and things at place of work. You can share contacts at your work, but maintain professionalism whenever you're talking to your colleague. Overcoming language and cultural barrier. Ask for clarification if you are unsure. If you don't understand anything, don't keep quiet. Don't go and manage. For patient safety, you need to understand what you're doing. Learn common UK medical phrases and acronyms. They have a lot. Each trust might have their own. So sometimes when I see some abbreviation, like 2 days ago, someone sent me a message and said WBA, and I was like, "What is WBA?" And I asked him, "Please, what is WBA?" And he said, "Work-based assessment." And I was like, "I've known this one today." So tomorrow, if I see it anywhere, I won't really feel like I don't know it. And sometimes, yeah, some of you can check on Google, but don't always dwell on Google. Someone might write something on Google, you might have 20 minutes. Ask specifically, "Please, what does this mean in this context?" And they will tell you. There's no harm in asking. Use interpreters in cases of language barriers. Use professionals, just like I've mentioned before. You need to go through NHS online guides like cross-cultural communication toolkit or health talk videos. You need to join staff networks for international doctors and minority. Yeah, in some trusts, they have some minority ethnic group. Try to join. You learn a lot from them. You might not experience everything before you learn. People share their experiences, and people give solutions to them, and you learn so that tomorrow, if you encounter such, you'll be able to, be able to tackle it immediately. Be open to learning about different communication styles. Very important. In summary and in conclusion, what are the top communication tips for doctor? Use experts for structured clarity. Use it. It's very simple and very easy to use. Flat, clear hierarchy. In NHS, you can speak up respectfully to your consultants. There is no biggest boss. Everybody, like in my trust, we call everybody by name. My consultant, if the name is Peter, I call him Peter. And that doesn't mean we sit down together, we eat. No one says, "Oh, this room is for these people, this people." Everyone is just like we relate equally but respectfully. You need to build respectful relationship with nurses and team. Is very important. Nurses are very closer to your patient. They are the ones that knows the patient very well. And you need to build good relationship. When people correct you, try to, accept the correction, and even if you want to have it your own way, tell them that, oh, you have a good point. That's a very really nice point, but I've started with this way. Let me just do it this way. Maybe next time I'll try. Or thank you for offering. It is very important to say thank you. Give the person so that tomorrow you might be in a big trouble and the person will be the one to bring up something that will help you. It's okay to engage in casual conversation. It builds rapport. Involve and inform patients and family, very important. And families, as I said, especially if the patient is awake, you need to let the patient know. Stay professional and approachable in all interaction. Avoid interrupting, please. It's when a patient is talking, sometimes you might be boring. Some of them will come up with something that are really not important, that are not even, but you give them some bit of time, and there's a way you stylishly drive them to what you want. But be polite and respectful. Don't let them know that you are not interested in what they are saying. And don't raise voice and don't use personal comments. Even to your colleagues, don't go to the back and talk about your colleagues with any of other colleagues. It's not really important, especially if you want to. Like me, I prefer if I want to talk about I say nice things about them. Oh, I've worked with her, she's really nice. That's very different thing. But not saying this one, oh, I don't like the way he doesn't have skills, he doesn't have. It's not good to talk about. People feel bad when they hear that people said that they don't have skills, especially when we are new to the system. It throws us off. And when I see people who are new and they're making some little mistakes, you will tell them, just be calm, no worries. We all made the same mistake when we came, but just try and ask questions. And it's not really, we were in this, all of us, when we came in, it's not really easy to adjust to the system. But just make sure that you communicate in order not to harm a patient. That's the most important thing. Even if it's culturally acceptable, please don't do it. Then be culturally sensitive and inclusive. Involve a senior chaperone when necessary. Thank you very much for listening. Your communication